Hi, sir.
Hello.
Sir, regarding gout, we all know that the main pathophysiology is hyperuricemia, that is increased levels of uric acid in the body.
Hmm.
But in treatment of acute gout, instead of reducing the uric acid levels, what is the main pathophysiology or how do we treat acute gout, sir?
Okay. In gout, you need to understand the pathophysiology first. Okay. In acute gout, what happens? First of all, say for example, there is a synovial joint. Okay. Now, what will happen from blood? This urate crystals will precipitate to the synovial joint. So once the urate crystals enter to the synovial joint, they start the inflammatory response. What will happen there? There will be the increase in the chemotactic factors like granulocytes. Okay. Once these granulocytes appear in that, these granulocytes come and engulf these urate crystals, right? Because of that, there will be a release of glycoprotein, and this glycoprotein will show the inflammatory action. Like either it will release the lysosome enzyme, destruct the joint, or else it can increase the lactic acid production, which will decrease the pH. And because of the pH decrease, there will also more attraction, more aggregation of the urate crystals. So by both these conditions, there will be the worsening inflammatory actions in the joint, and because of that inflammation in getting increased, there is the pain, swelling, and redness is the main important key factors symptoms for the acute gout. So our main aim is to treat these symptoms: pain, swelling, and inflammation. Now, why we do not aim to decrease uric acid? That is your query, right? So
Yes, sir.
what happens? If we decrease, we try to lower the uric acid. Okay, so in blood, if we decrease the uric acid, but there is a uric acid in some other liver, and bones, and some other places also in muscles. There is uric acid. What will happen? You decrease the uric acid in blood. This uric acid here and concentration is higher, in blood concentration is lower. So the because of the gradient, this uric acid will come again to the blood, and the quantity of the level of the uric acid will again increase. Okay, so we do not aim, और acute में कभी करना भी नहीं है क्या, lower level करना भी नहीं है. Why? It will increase again and it will precipitate the condition more worsen even. So our main aim in acute to treat the symptoms as the patient is coming, whatever the symptoms: pain, swelling, and inflammation. So just treat that. Do not try to lower the uric acid. That is the main important thing. Okay.